Noma disease is a horrible disease. It takes away the dignity of children and, after all, adults, because when Noma leaves a dent in the face, you can only correct that through surgery, through an expensive surgery.
Operational research is important in the many different thematics that MSF works in. We try to identify what knowledge gaps are. We have dedicated an operational research training to climate, environment and health, or at least the thematic of that, because we see the impact of climate change in our projects, but we also see that the populations we work with are often more higher at risk for the impact of climate change. And an operational research training can make our staff that work in our projects more capable of conducting research independently.
So in my previous capacity as a data entry officer and a data supervisor, I noticed that there were reasonable more cases coming at some times of the year than the other time of the year, and it was more like a data call to say, why do we have more patients at this time than the other time? So that was where the idea originated from, and I think that if we could find out why we have more cases at a time of the year, we could be well prepared, try to prevent or even halt maybe the progression of the disease. We are also trying to see if due to climate change there could be some climatic indicators that have been affected that could have caused the increase in these cases in this particular time.
So my role is to guide Michael through the process of MSF, the ethical approval process of a research, the design, data analysis, etc., and also to ensure quality, a minimum qualities. For Michael's evolution, I see more than the technical aspects that for sure they are there, I see really a lot of empowerment over time. He got to the training as a student, and now he's really a researcher. He leads his research, he makes the decisions, he comes for advice, but he really owns the project. For this research is very interesting from purely basic science point of view. We are gonna answer a question that has been there for a long time. Is there a correlation between seasonability and Noma? So just for the pleasure of knowing, this is nice, but also it's gonna impact a lot MSF operations and the general healthcare system in Nigeria, being able to predict, to understand why we are gonna get more patients or less patients. It's gonna save a lot of time, money, it's gonna help us plan better and for sure save life and help our patients. So Doctors Without Borders may try to communicate the results, for example in this case, to the Nigerian Office of the World Health Organization to try to change guidelines or to open the way for discussion panels or a call for further evidence. Particularly in the case of Noma disease, it has been Doctors Without Borders that pushed for the inclusion of this disease in the list of neglected tropical diseases that was done in 2023.